8 medications that research has linked to a higher risk of developing dementia. Hello, I'm Dr. Marcos. Welcome to the You Stronger channel. Before we start, I'd like to invite you to leave a comment about the city you're watching me from. It's essential to understand that memory loss isn't just a normal part of getting older. Recent studies indicate that we can maintain our brain health for much longer than we once believed, provided we know how to care for it properly. So, why do some medications, which appear harmless, cause such significant harm? And how can we safeguard our brains while managing other health issues? These are vital questions we will address throughout this video. We want to stress that we're not here to criticize modern medicine. Many of these drugs are crucial for treating severe health issues and enhancing the quality of life for countless individuals. But before sharing this information, subscribe to my You Stronger channel, leave a like on this video. I need as many likes as possible to help reach and help more people. Can I count on your support? However, it's vital to be aware of the potential risks and learn how to minimize them. First on our list are the silent offenders, Omeprazole and Anticholinergics. Let's dive into our discussion with Omeprazole. Omeprazole is one of the most widely used medications for treating heartburn, reflux, and stomach ulcers. It falls into a category known as proton pump inhibitors, PPIs. Sounds safe, right? Unfortunately, that's not entirely true. Recent research has uncovered a troubling link between long-term use of omeprazole and an increased risk of dementia. One study involving around 6,000 participants found that 10% of those who used omeprazole for over 3 years experienced memory issues. Another study revealed that 33% of patients who took this medication for more than 4.5 years reported cognitive problems. So, how does omeprazole affect our brains? Experts believe it may disrupt the absorption of vitamin B12, which is essential for neurological health. Moreover, omeprazole can change gut microbiota, potentially leading to negative effects on brain function. It's important to highlight that we are not advising anyone to stop taking omeprazole right away. If you regularly use this medication, consult your doctor about alternative options or the possibility of reducing your dosage. In many instances, adjusting your diet and lifestyle can effectively manage gastric issues without the need for ongoing medication. Now, let's shift. Of anticholinergics is linked to a considerable rise in the risk of developing dementia. A study conducted by the University of Washington, which monitored over 3,500 older adults for a decade, revealed that those who regularly used anticholinergic medications had a 54% increased risk of dementia. Some commonly used anticholinergic drugs include first-generation antihistamines like diphenhydramine, certain antidepressants such as amitriptyline, and medications for urinary incontinence like oxybutynin. The widespread use of these medications, particularly among the elderly, raises concerns due to their potential contribution to cognitive decline. If you are currently taking any anticholinergic medications, do not stop them suddenly. It's essential to discuss safer alternatives or the option of lowering the dose with your doctor. Both patients and healthcare providers must carefully weigh the risks and benefits of anticholinergics, looking for alternatives whenever possible and keeping usage to the lowest effective doses for the shortest durations. Remember, the main concern is prolonged use. Taking an antihistamine occasionally for allergy relief is unlikely to lead to long-term issues. However, consistent use, especially in high doses, is what really worries researchers. Next on our list are the hidden dangers of corticosteroids and benzodiazepines. While these medications are effective in treating various conditions, they can have significant side effects on the brain. Let's begin with corticosteroids. These medications are commonly used to manage a range of conditions, including asthma, allergies, autoimmune diseases, and inflammatory disorders. They are highly effective in reducing inflammation and controlling overactive immune responses. However, long-term use of corticosteroids, especially when taken orally, is linked to several serious side effects, particularly concerning mental and cognitive health. Research has shown that corticosteroids can lead to structural changes in the brain, resulting in issues like disorientation, confusion, depression, and anxiety. An epidemiological study in the UK, which examined data from over 500,000 individuals, found that those who used corticosteroids for asthma over extended periods faced a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids, such as prednisone and dexamethasone, are especially worrying when used for long durations. They may disrupt brain function, potentially due to alterations in cortisol levels, a stress hormone that, in excess, can harm neurons in the hippocampus, the area of the brain responsible for memory. If you are using corticosteroids, particularly for long-term treatment, it is vital that your use of these medications is closely monitored by healthcare professionals. Never discontinue corticosteroids suddenly, as this can pose serious health risks. Instead, consult your doctor about the possibility of tapering off the medication gradually or exploring alternative treatments. Now, let's move on to benzodiazepines. These medications are frequently prescribed for anxiety and insomnia. Known for their calming effects, drugs like alprazolam, diazepam, and lorazepam provide effective and rapid relief from anxiety symptoms. However, using benzodiazepines for an extended period can lead to serious consequences for brain health. Studies have shown a clear link between long-term use of these medications and memory loss. Research indicates that taking benzodiazepines may double the risk of developing Alzheimer's disease, potentially due to lasting damage to the brain. One study revealed that over 40% of benzodiazepine users reported various neurological symptoms, such as trouble concentrating, fatigue, anxiety, and heightened sensitivity to sensory input. Beyond memory loss, long-term use of benzodiazepines is associated with several other negative effects. These can include sleep disturbances, increased anxiety, muscle pain, and weakness. There is also a significant risk of developing physical and emotional dependence, which can make it difficult for many individuals to discontinue these medications. The connection between benzodiazepines and Alzheimer's is especially alarming. While the exact mechanism remains unclear, it is thought that these drugs may disrupt neurotransmitters, leading to both structural and functional alterations in the brain. Moreover, prolonged use can adversely affect sleep patterns, which are essential for memory consolidation. If you are prescribed benzodiazepines, it is crucial that their use is carefully monitored and kept to a minimum. Doctors should explore non-drug alternatives to manage anxiety and insomnia, including cognitive behavioral therapy, relaxation techniques, and lifestyle changes. When using benzodiazepines is essential, it should only be for short durations and at the lowest effective doses. It's crucial to remember that stopping benzodiazepines suddenly can lead to severe withdrawal symptoms. Always consult your healthcare provider before making any adjustments to your medication plan. Unexpected risks. Now, let's dive into two more types of medications that might surprise many: amphetamines and first-generation antihistamines. First, we'll discuss amphetamines, including the well-known Adderall, which is commonly prescribed for attention deficit hyperactivity disorder, ADHD. These medications are recognized for their ability to enhance focus and reduce hyperactivity in the short term. However, using amphetamines for extended periods can lead to significant negative effects, including memory loss. They function by increasing levels of neurotransmitters like dopamine and norepinephrine in the brain, which temporarily boosts concentration and attention. Nonetheless, long-term use can result in various issues, such as physical and emotional dependence, sleep disturbances, irritability, and even depression. One of the most alarming side effects linked to prolonged amphetamine use is memory loss. Research indicates that high doses of amphetamines taken over extended periods can lead to permanent brain damage. In addition to memory issues, individuals who use amphetamines long-term may experience a drop in motivation and overall cognitive performance. Alarmingly, these effects can linger even after stopping the medication, suggesting that the damage may be lasting. Another major risk associated with amphetamines is their potential for abuse and addiction. Due to their stimulating properties, these medications can be misused, leading to serious complications, including heart arrhythmias, gastrointestinal issues, and even sudden death. Psychological dependence can also pose a significant challenge, making it tough for users to quit even when the negative effects become apparent. If you or someone you know is taking amphetamines for ADHD, it's crucial that their use is closely supervised by healthcare professionals. Therapeutic alternatives and non-pharmacological methods, such as behavioral therapy and stress management techniques, should be considered when treating ADHD. Now, let's shift our focus to first-generation antihistamines, like chlorpheniramine and diphenhydramine. These medications are commonly used to alleviate symptoms of allergies and colds. While they are effective in providing quick relief from issues such as nasal congestion and itching, they come with a hidden downside. Their long-term effects on memory and cognitive function can be concerning. First-generation antihistamines operate by blocking the action of histamine, a substance in the body that triggers allergic reactions. However, they also exhibit anticholinergic properties, meaning they inhibit acetylcholine, a neurotransmitter vital for memory and learning. Prolonged use of these medications can lead to considerable cognitive impairments. Research indicates that first-generation antihistamines are linked to an elevated risk of dementia. A recent review encompassing 138 studies on the adverse effects of these medications highlighted a strong correlation between extended use and cognitive disorders. Patients who regularly use these medications reported memory problems and difficulty concentrating even after stopping use. Fortunately, there are safer alternatives, such as second-generation antihistamines like loratadine and cetirizine. These medications have fewer side effects and are not associated with cognitive issues. They are preferred for long-term allergy treatment, offering effective symptom relief without the same risks to brain health. In addition to cognitive risks, first-generation antihistamines can cause other side effects such as drowsiness, dry mouth, and blurred vision. These effects can significantly impact quality of life, especially in older adults who are more susceptible to the adverse effects of these medications. To minimize risks, it is important for patients to consult their doctors before using first-generation antihistamines for extended periods. Considering safer alternatives and adopting other allergy management measures, such as environmental and dietary changes, can help reduce the need for these medications and protect cognitive health. Remember, if you are using any of these medications regularly, do not stop abruptly. Always consult a healthcare professional before making changes to your medication regimen. The unexpected: tricyclic antidepressants and statins. We have reached the final topic on our list, and now we will discuss two types of medications that may surprise many people: tricyclic antidepressants and statins. Let's start with tricyclic antidepressants. Medications like amitriptyline and nortriptyline were among the first developed to treat depression. While effective in alleviating depressive symptoms, these drugs have a side effect profile that includes memory loss and other cognitive issues. Tricyclic antidepressants work by blocking the reuptake of neurotransmitters such as serotonin and norepinephrine, increasing their availability in the brain. However, they also possess strong anticholinergic properties, meaning they block acetylcholine, a neurotransmitter vital for memory and learning. Prolonged use of tricyclic antidepressants has been associated with an increased risk of dementia and other cognitive disorders. Studies show that patients who regularly use tricyclic antidepressants experience a faster decline in cognitive function compared to those who do not use them. These medications can cause difficulties in concentration, confusion, and both short and long-term memory loss. Furthermore, the risk of adverse effects is particularly high in older adults, who are more sensitive to the anticholinergic properties of these drugs. Fortunately, today there are safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs. SSRIs are designed to improve mood with fewer cognitive side effects, making them a preferable option for many patients. They work by selectively inhibiting the reuptake of serotonin, enhancing its availability in the brain without significantly impacting acetylcholine levels. For those concerned about cognitive health while managing depression, SSRIs may provide a more suitable treatment path. If you or someone you know is using tricyclic antidepressants, it's crucial to have an open conversation with a healthcare professional about potential risks and alternative treatment options. Making informed choices can help protect cognitive function while effectively managing depressive symptoms. Let's talk about statins, a topic that has generated much controversy in the medical community. Statins, such as atorvastatin and simvastatin, are widely prescribed to lower cholesterol levels and prevent cardiovascular diseases. While effective in protecting against heart attacks and strokes, there is a growing body of evidence suggesting that prolonged use of statins may have adverse effects on cognitive function. Studies indicate that some individuals taking statins experience memory problems and mental confusion. Although these side effects are not common, they can be significant for those affected. It is believed that statins may interfere with cholesterol production in the brain, which is essential for synapse formation and overall cognitive function. Cholesterol is crucial for maintaining cell membrane integrity and facilitating communication between neurons, and any disruption in its synthesis could potentially impact cognitive health. A review of observational studies and clinical trials has shown mixed results regarding the relationship between statins and cognitive function. Some studies suggest that statins may even protect against dementia, while others indicate an increased risk of memory problems. This discrepancy may be attributed to differences in the population studied, varying statin doses, and treatment durations. Moreover, some patients may be more susceptible to cognitive side effects than others. It is important to emphasize that the cardiovascular benefits of statins are well established, and for many individuals, these benefits outweigh the potential cognitive risks. However, it is crucial for patients and doctors to engage in open discussions about the potential adverse effects of statins. Monitoring cognitive symptoms closely is essential, particularly in older adults, who may be more vulnerable to such side effects. If you are taking statins and have concerns about cognitive health, do not hesitate to consult your healthcare provider. They can help assess your individual risk factors and determine whether adjustments to your treatment plan are necessary. Balancing the benefits of statins with potential cognitive risks can help ensure optimal health outcomes. In some cases, adjusting the dose or switching to a different statin can significantly help alleviate side effects. It's essential to have these conversations with your healthcare provider, as they can guide you in finding the most suitable option for your specific needs. Additionally, patients should be encouraged to adopt a healthy lifestyle that includes a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, along with regular exercise. These lifestyle changes can play a crucial role in helping control cholesterol levels and may reduce dependence on medication over time. Remember, your brain is your most precious asset. Protecting your cognitive health is just as important as maintaining your physical well-being. Take care of it with wisdom and attention. Stay informed about your medications and health, ask questions to your doctor, and make conscious decisions regarding your treatment and lifestyle. I hope this video has helped you. Please share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. This will help this content reach more people around the world. Thank you very much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.